Hi, if you have epilepsy, then you should avoid these 7 triggers to make sure that you do not have seizures and live a seizure-free life. And at the end, I will give you the treatment if your seizures continue to happen even if you control all the triggers. The first trigger for your seizures is your anti-seizure medications. Whoa, that is a surprise. Well, here's what happens. If you have epilepsy, not all epilepsy types are the same, and not all seizure medications works for all epilepsy types. So if you have focal epilepsy, mean the seizures are coming from one spot in the brain, all anti-seizure medications work. But if you have generalized epilepsy, which is usually a genetic cause, generalized tonic-clonic seizures, jerks, then not all the anti-epilepsy medications work, and on the contrary, some anti-seizure medications can worsen your seizures and make them happen more. And this situation usually happens with medications such as sodium channel blocker family, such as carbamazepine, oxcarbazepine, phenytoin. They can worsen your seizures if you have the syndrome of generalized epilepsy, such as juvenile myoclonic epilepsy. And the other thing about medications is that if you miss medications, then that can be the trigger for your seizures. And it is actually the most common trigger for your seizures is missing the medications or not being consistent with medications. Anti-seizure medications are not very forgiving in the situation of forgetting the medications. So if you have epilepsy and you take the medications every single day and night exactly how you were prescribed it, that is good, and that's how you prevent the seizures from happening. But if you slip here and there, even one dose can be enough to trigger a breakthrough seizure. So make sure to be very consistent. Things that you can do is setting alarms, making sure that the pills are with you in your purse or on you in your work, so that even if you forget in the morning, you can take it during the day, and keep them on the counter somewhere that is open and you can see them directly. Even opening the counter can be enough to avoid taking the medication. And the second trigger is lack of sleep. Sleep is very, very important in epilepsy. What happens is that, like in sleep, there is lots of cleaning and resetting everything in the brain. So if you do not have good amount of sleep, then the seizures will not be under good control. So we recommend to get at least 8-hour nighttime sleep that is consistent. And if you have anything that is disturbing your sleep, like waking up multiple times or having a night shift or any of that, that can cause seizures. And we always check for sleep apnea, which is like having snoring and wake up during the night and wake up tired. That can be a trigger for your seizures. So getting that under good control is important. And the third factor is stress. Stress is a major trigger for seizures. Either physiological stress means like you work hard, you're running a marathon, or work too hard on your body, that can trigger a seizure. Or if it's a psychological stress, worry, stress, anxiety, all of that can be a trigger for your seizure. And the fourth one is infection. Infection is very commonly to cause seizures and epilepsy to get worse. Usually if there is any viral infection or there is bacterial infection, COVID-19 itself, any infection can make seizures happen easier because of the stress on the body and the inflammation that is accompanying the infection. So it is very important to treat the infections appropriately and right away to avoid having seizures. And sometimes the fever with the infection can cause the seizures to happen in people who have epilepsy that is sensitive to high temperatures. And the fifth factor is hormonal imbalances in certain times of the month. So in females, there is imbalance in the hormones during the menstrual cycle, and we have that fluctuation in the hormones can trigger seizures in certain times of the period. And we know that this is called catamenial epilepsy. And I made a video about this catamenial epilepsy and how to characterize it and what are the certain types of catamenial epilepsy and how we can treat it. So you can review that and put a link in the description below. And the sixth factor is alcohol. I know that alcohol is a sensitive topic here for epilepsy, but we know that alcohol and epilepsy do not mix well. And usually seizures can get triggered by alcohol itself, especially if it's excessive, more than 3 drinks or binge drinking. And it can be the alcohol withdrawal can cause seizures as well. And we know that alcohol does interact with anti-seizure medications. It can change their levels, and anti-seizure medications makes it easier to have alcohol symptoms much earlier in the drinking rather than later. So we advise to avoid alcohol completely if you have epilepsy. And the seventh factor are the triggers for seizures, and the most important trigger is drugs. So if you take drugs such as stimulant drugs like cocaine or amphetamine, those can trigger your seizures. And the other thing is food. If you are hungry, if you skip meals, that can be a trigger for seizures. And so as dehydration can be a major trigger for somebody's seizure. Some certain foods like high calorie foods and anything in excessive can be a trigger for your seizures. And then the question about caffeine and seizures and coffee is kind of plus and minus. So usually coffee by itself and caffeine does not trigger epilepsy, even though we have some reported cases of people who have seizure triggered by caffeine, but this is rare. But caffeine, if you consume it after noon, it can delay the sleep and it can disturb the sleep, and that by itself can cause seizures to happen. And in some cases of epilepsy, flashing lights, especially high frequency and consistent flashing light, can be a trigger for seizures, and it's called photosensitive epilepsy type. And if you're still having seizures despite controlling for all those factors and taking your medications consistently, and if you took at least 2 medications, then you might be having what we call drug-resistant epilepsy. If you would say this is a stubborn type of epilepsy that continue to happen even with all the medications. And to treat that and what is drug-resistant epilepsy, I made this video to detail all the diagnosis and the possible treatments, including surgical treatments, in one video that you can review. And stay healthy, and see you in the next one. Salam.